and that way we can post it on our website for others to take a look at if they missed the conference today. Also, if everybody could mute their computers and or phones at this time, just so we don't have any interference, that would be great. My name is Janine Taylor. I'm the Public Information Officer for District Health Department number 10. It's nice to see some faces for a change. I've been working at home since COVID hit, so it's nice to see some faces. On the call, we're going to have Kevin Hughes, who's our Health Officer for District Health Department number 10, talk about he's going to review the cases. He's going to talk a little bit about our processes that we perform through contact tracing and how we go about doing that. Also on the call is Dr. Jennifer Morse. She is our medical director, and she's going to review some of the data and look at some percentages and give a little more detail on the data. We will cover both Oceana and Newaygo counties, since those are neighboring counties and the 2 out of our 10 counties that we cover that have experienced some outbreaks that we want to talk about. And then we're going to announce also our town hall, our virtual town hall that we're having on Monday. So we'll talk about that. After Dr. Morse is done, I'll jump on and talk about that. And then we will open it up for questions. So why don't we start with Kevin Hughes? Kevin, take it away.
Thanks, Janine. Again, as Janine said, my name is Kevin Hughes. I am the Health Officer for District Health Department number 10. And the pieces I'm going to cover today are going to be kind of a little bit of an update on our cases. Now, the numbers I'm going to give you are our totals through yesterday at 3 when we had updated our numbers, and then a little bit about the process is involved with our contact tracing, which is part of all of the investigations that we do. So if you look at when we updated our numbers, we did have 24 new cases, positive cases within our jurisdiction as of yesterday. One of those cases was in Missaukee County. We had 11 new cases in Newaygo, 11 in Oceana, and then 1 new case in Wexford. And so that brought our total number of positive cases in our jurisdiction to 572 cases. Of that 572, 331 of those would have met the definition of recovered. That definition is from the point that individual is confirmed positive. If they are alive 30 days out from that, they are considered as meeting that definition of recovered. So of the 572, 331 of those individuals would meet that definition. Specifically related to Newaygo and Oceana County. Newaygo County now has a total of 157, or as of yesterday at 3 o'clock, 157 had a total of 157 positive cases, and Oceana County has a total of 214 positive cases. For recovered cases in those 2 counties, 92 individuals have recovered in Newaygo County, and 81 individuals have recovered in Oceana County. So those are the case numbers that I have to share with you. The other part of the piece that I'm going to share deals more with, what happens within our agency when we are notified of positive cases. And when we do have a confirmed positive case in our jurisdiction, it is assigned to one of our public health nurses. It may be the nurse that is in that county. It may be one of the other nurses that we have pulled in to help with this effort within our jurisdiction. But that whoever gets that case will initiate our case investigation process. And as part of that, they will contact the individual and try to determine or ascertain all of the potential contacts that this person may have come in contact with. And that would actually start from a period of time, 48 hours prior to the person displaying symptoms. So they'll ask when the symptoms began and then go back 48 hours and begin to gather those contacts at that point. Once all of those potential contacts have been gathered, then they will be kind of risk assessed. And then based on that assessment, our nurses will begin the process of contact tracing, reaching out to those potential contacts and contacting them and assessing where they're at and providing the appropriate guidance depending upon, you know, the length that contact may have been. This is a process that we use not only for COVID, but also for any other type of communicable disease when we would go through the process of case investigation and contact tracing. So this is something that health department staff are very familiar with. They're very good at doing this because this is part of what we do every day. So those were the pieces that I intended to cover to give you a little bit of information on there. Dr. Morris may have a little bit more information that she wants to share, some specifics maybe on the contact tracing and the case investigation. And then I believe she is going to review some of the data that we have.
Thanks. I don't believe you really discussed what a close contact is. The standard definition used really worldwide is someone that you've had contact with for at least 15 minutes and within 6 feet of distance, about 2 arms length away. The most risk people have with close contact is a household member. So the people we see getting infected the most are household members or non-household member family members. Also people that you spend a lot of time with, have frequent contact with, maybe dine with. A close contact is not someone that you may have casually walked by, such as in a grocery store, or been more than 6 feet apart from. Another person that's not considered a close contact would be a healthcare worker who is wearing the appropriate protective equipment. If a healthcare worker is not wearing the appropriate health or protective equipment, they would be considered a close contact if they've been within 6 feet for more than 15 minutes. So once we get that information, most people can remember all the people they've had close contact with, or their work site, we're able to make contact with those individuals. If there's been a location where they had risky interactions like a wedding or church, we usually will send a letter to those facilities to share with individuals because they may not remember everyone that they've had close contact with. If they've been to stores or locations like that, unless they had a very long interaction with one person within that store, those are not considered close contacts. If they had a prolonged time in a bar, very close interactions, we would make public notification. But again, unless there was a prolonged interaction, those aren't considered close contacts. Sometimes people are not completely forthcoming with who they've had contact with, or they might not remember, but we do a very good job of contacting those people very quickly, the ones that we know about. So looking back at the data from Oceana and Newaygo, there have been several facility outbreaks. And again, these are people that are spending a lot of time together. Given the warm weather, things like that, it might be difficult to use all the protective measures that they need to. So in Oceana, around 60% of their cases have been related to 5 facility outbreaks. Those have been farms and manufacturing facilities. They have not been public businesses. So it's not been places where people other than the employees have been exposed to. So about, again, 60% of those cases are associated with that. 25 of the cases are in their family members. So again, some cases started at work, and then 25 cases, or about 19%, then went on and were spread at home. One of the outbreaks started in May and has continued into this month. The rest of the outbreaks have all been occurring within this month. 2 of the outbreaks have accounted for almost 120 cases. So there's been 2 very large outbreaks. And we've been working very hard with those facilities to help them to do everything they can do to help stop those outbreaks. The rest of the cases in Oceana County have been in the community. Only about 8% of the cases in Oceana County started from community spread, which means we don't really know where they got it. Then they went on to spread it within their family members. So around 60 cases have occurred because someone caught it in the community and then spread it to their family members. So again, we see for about every 1 case that was caught in the community, it caused about 3 household members to get sick on average. We've seen some smaller, just husband-wife cases. We've seen some family members of 7 people, but on average, it's been about 1 to 3. So again, the biggest issue has been facility outbreaks. A much smaller risk has been community cases, but then gone on to spread it to family members at home, which, like I said earlier, that really is the biggest risk. There really has not been a major pattern to the community occurring cases. Some have worked in healthcare. There have been individuals working in roofing and construction. There's been truck drivers, but there's also been people who have been retired or unemployed. And really, there's not an obvious risk for occurrence for illness. Some are picked up when they've had testing prior to a procedure, so they've not been symptomatic, and it was just detected on screening testing such as that. In Newaygo County, there have been 7 different facilities causing about 35 of the cases. Again, these numbers are from a couple days ago. But in Newaygo County, let me scroll down here. So about 22% of the cases in Newaygo County are from 7 different facility outbreaks, but they're much smaller. The largest one has had 14 cases, or sorry, the largest one has had 17 cases, and the second largest has only had 4. So they're much smaller, just there's more of them. And again, these are all farms or factories, not public businesses, not having any other exposures other than their employees that we know of. As far as we know, there's not been any spread to their family members. And then outside of the facility outbreaks, and these are the same with Oceana, we're going back all the way to the beginning. In Oceana, it started in April. In Newaygo, it started in March. Oceana has had only about 13% of their cases starting in the community and then going on to infect family members. And they've had the same, about 1 community case leading to about 3 family members or household members getting infected. And so that's been the pattern, and still not really an obvious risk factor in Newaygo. The only difference in Newaygo is that several people that have become ill in the community have worked outside of the county. So Kent County in particular, but also Muskegon County and Montcalm County. And as you may know, some of those bigger counties do have higher case counts. So that may be a risk. We never know where they got it from, but that may be a risk. But again, other occupations that we see here, some people work in banks. Again, some have worked in other farms, but none of the farms with known outbreaks. But again, others are retired or unemployed. So truly community spread. So again, big risk in Oceana right now are just facility outbreaks, which we are helping them to work on. And again, we see the community spread, but then leading to household spread. So I think that kind of wraps up my data summary. I'll turn it over to Janine.
Okay. Thank you, Dr. Morse. Thank you, Kevin, for reviewing that information. I did push out to the media an invite to a town hall that we're going to have on Monday. So we're going to start promoting that today. This has all come together fairly quickly, but we felt that it was important for us to get the information out as quickly as we could. So we have scheduled a virtual town hall. It's going to be through Microsoft Teams, just like this meeting is. On Monday, June 29th at 2 p.m. So I did send that on to our media contacts, so you all should have gotten that invite. And we encourage you to share that with your listeners, readers, viewers, if you would. And we are asking that the public email us their questions ahead of time so that we can just make sure we have time to cover the things that people want to know. So there is an email, info@dhed10.org, that we ask that the public email their questions ahead of time. There will be time at the end of the presentation for question and answer as well. We just want to make sure we get that we cover the information people are interested in knowing. So with that said, we will open it up to questions. So if you just want to unmute yourself, if you have a question, feel free, and we will do our best to answer.
Hi,
Hello.
I don't know if you can see me.
Mm-hmm.
Yes.
Yeah, I can.
I'm from the Ludington Daily News. I'd like to know how exactly you're helping the facilities that have these large outbreaks mitigate further spread.
So Dr. Morse or Robin, we have Robin Walicki on the line too. She's one of our clinical supervisors that that actually lives in Oceana County. Robin, do you want to take that one?
Sure. Actually, that is a good question. And our public health nurses work very closely with the businesses as they are impacted to make sure that they have all the resources they need that are up to the minute on CDC and state guidelines. Working with them to make sure that they're screening other employees, checking temperatures as needed. So it really depends on the situation, the workplace, how many people are there. And a lot of the public health nurses actually establish very close relationships with the human resources contacts at the businesses. So it truly is a partnership.
Probably, this is Kevin, and probably adding to that in terms of working with the work sites, we do have a team of our community health workers that also, when we have to isolate individuals or quarantine contacts to them, we do have our community health workers that will, contact them and see what it is that they may need in terms of prescriptions picked up, food, water, and then try to either work with some of our existing partners to get those supplies, or if it's something that we have to provide them, again, all for the purpose of trying to keep them to stay home, where we're asking that they isolate or quarantine. So that's another piece that we have been involved with too.
And then we've also helped arrange testing for coworkers, which has helped to discover a lot of cases. A lot of the cases have been asymptomatic, but that's why you often see case counts increasing, but then we also know how to help stop that outbreak. So in one facility, I know the team worked very, very hard to get a testing event for the facility.
Okay. Does that answer your question, Hannah?
Yes, thank you.
Okay. Melissa, looks like Melissa's with the Detroit News, correct? Or Free Press, one of the two?
Yep, the Detroit News. Thanks so much for doing this call. I just had a quick question about the outbreaks you mentioned. I wondered, particularly in the agricultural outbreaks, is part of this because, some of these migrant farm workers in particular they live in group housing and it gets spread in that, potentially in that way, and then potentially are some of these folks continuing to go to work sick? Is that a concern?
Robin or Dr. Morris, Dr. Morris, you want to take that one?
Certainly in some farms there is large housing situations, and there is definitely easy spread in those situations. Some go to work ill, some are having trouble going home if they're ill due to work pressures. There's many different factors going on, but certainly we've had outbreaks in other counties as well with migrant populations, where there's a fear of not working because of fear of losing work, being replaced. There's no availability for sick leave, even through the COVID aid. So it's really multifactorial. And again, some have employer pressure to not leave work if they're sick. So, not in any particular county, but in any of the farming situations, there definitely is struggle with housing, with, fear of work, loss of income. And so we have worked really hard from the beginning to basically do the most good with the least damage. Sometimes you have to bend things a little bit to contain things to one farm rather than the fear of someone taking work at another farm and potentially spreading things further. I don't know if Kevin or Robin want to add to that before I talk in circles.
No, I think that sums it up. I think obviously you sometimes in the migrant setting may have 2 or 3 generations of individuals who live together, and that is their support system. And so, trying to break that system up can be problemsome, and that is not, and so then we kind of, and I don't know, Robin, you can correct me if I'm wrong, but we sometimes get creative with our isolation and quarantining processes.
Yes, I would agree. We definitely get involved in a lot of unique situations. And also, I think a lot of people have been panicked looking at our numbers, because if 1 or 2 family members are positive and the rest of the household decides to get tested, you'll see our numbers jump, sometimes 3, 4, 5 people per house, which definitely concerns the public, but they don't realize it's within one home.
Okay, it looks like we have some hands raised. Melissa Frick, if you want to go ahead and ask your question.
Yeah, hi, thank you. I'm Melissa Frick with MLive and the Muskegon Chronicle. I had a quick question regarding some of the age data available for Oceana County right now on the website. It looks like there's a large number of people who tested positive for the virus who are either below the age of 19 or in their 20s. And I was curious how much of that is linked to the outbreaks in Oceana County farms and factories, or whether that disparity was, I guess, already there.
And I have to admit, I did not really review the ages. My assumption would be it's mainly linked to the working age. But I don't know, Robin, do you have any insight in that?
I think that really reflects the family members being tested and the spread within households, branching out from those outbreaks.
Does that answer your question, Melissa?
Yes, thank you very much.
You bet. Any other questions? Hannah, go ahead.
Will you be providing a list of these farms and facilities that have had major outbreaks?
We typically don't provide the names. Go ahead, Kevin. I'll let you. I'll let you answer that one.
No, I was going to say, when we started in this, when COVID started here and we began, going through this process as an agency, obviously we had made the decision that we were not going to release names of facilities or businesses or work sites unless it involved the the need to protect public health. And as Dr. Morris had indicated, so far, knock on wood, the facilities and that we've had to date are not public places. So the public is not able to readily access these individuals. And so we have not released them, and we do not intend to release them again, unless we are in a situation where the need to protect public health, meaning public has access into these buildings or facilities, then we would, if that situation were to warrant.
Any other questions? Anna, did you have another question?
I wanted to follow up on that question. Since you won't be providing the names of the facilities, will you be narrowing down the locations at all, further than zip code to certain block areas, that kind of thing?
Again, what we're trying to de-identify the data and the material as much as possible. And so I believe what we're we don't have an intention to go beyond what we're doing right now, again, unless the situation were to warrant it.
And in terms of that, there are some people in Newaygo County that are related to outbreaks in Oceana. There are some in Oceana related to Newaygo County outbreaks. there's some in Newaygo County that are related to outbreaks in other counties outside of our jurisdiction. And so, you know, the facility itself may be where it started, but these individuals live all over the place. And so, you know, it's the facility, again, it's where the people then go and live that is really the risk. And again, it's mainly their household members that then are at risk.
And I think if I can add, I think the important thing to remember is the guidance doesn't change whether you know a location or not. It's the same guidance that everybody should follow of masking, social distancing, avoiding large congregations, following the executive order. And you know, it's very difficult to determine at least where the initial individual picked up the virus. We do see that it's spreading rapidly through households. So family members and household members are getting it quickly, or workplaces are getting it quickly. But other than that, it's difficult to say if somebody went to one particular gas station. You know, we're not gonna mention the gas station because it could be that 5 other people that were asymptomatic and had no idea went to a different gas station, and so we want everybody to assume that somebody that was asymptomatic could have been at any facility you go to, any public place that you go to. So it's important to assume that every location has had an individual there that could be asymptomatic right now, not knowing that they have it. And so following the guidelines all the time is what we want everybody to do. Anna.
So going back to the contact tracing, when you're doing that and you, for example, find out someone in a household has been in close contact, like that process you described, what warrants testing for those contact persons?
It is recommended that close contacts get tested. However, there is some issues with getting availability to testing in some communities. So, but it is recommended by the CDC and other organizations that close contacts do get tested, ideally around 5 days after they're exposed. It's not essential, and they would still have to be under quarantine even if they were negative for the full 14 days. But if they're positive, then we know that they're infected. And then if they had any contacts 48 hours before they test positive, then we'd know that they need to be contacted and quarantined. So that is the recommendation. Again, we don't always see that happening because a lot of the healthcare systems and those that are providing testing are unable to provide testing to those who don't have symptoms simply because there's just a shortage of testing supplies. So like Robin said, a lot of the big jumps in the numbers we're seeing is because the close contacts are getting tested and they're positive, they're asymptomatic, but they're positive. And so you see 1 turn into 5 and multiply that by 5 over and over again. So about 50% of people who are infected are asymptomatic. And so as you test, you find, but that's how we want it to be so we can isolate.
Any other questions? Anna, do you have another question?
I do have another question. Looking specifically at Oceana County, I haven't checked lately, but you mentioned there's a shortage in testing. Where are the places people can go to get tested in Oceana right now?
Unless you guys know that.
Robin, do you want to, or I can?
I can talk about that.
Okay.
Actually, the larger healthcare systems are options. Spectrum has a hotline, and Mercy Hospital, where people can call to get approved to be tested. And Northwest Michigan Health Services in Shelby is an option. So we do have, definitely, I'm seeing more people be able to get tested when they have symptoms, and it's been going fairly smoothly.
Hey, Robin, this is Sarah, but NMHSI will test not asymptomatic. You don't need a physician's order.
Thank you, Sarah.
So the Shelby Clinic, the Northwest Michigan Health Services has a drive-through clinic in Shelby. It has a standing doctor's order that would cover anybody that wants to be tested. They just need to call that organization to schedule an appointment. So it isn't one where District Health Department number 10 has been hosting some community pop-up tests where you don't need an appointment. You can just drive up and get tested. In fact, we have completed our pop-up site in Manistee today. We also are going to have one in Cadillac on Tuesday and Wednesday. It's open for any community, any individual. You don't have to live in Cadillac or Wexford County to attend. And you don't have to schedule an appointment or have a doctor's order. So it is a drive-through testing clinic. But the Shelby Clinic, you do need to schedule an appointment with them, and then they will give you a time where you can drive through and get tested at that facility. And a lot of Oceana County individuals have been tested there, as well as the hospital systems. Any other media? Anybody else on the call? I see Madison from 9 and 10 is on. Madison, do you have any questions?
Nope, you guys pretty much summed up every question that I've got. So I'm good over here. Thank you.
Fantastic. Melissa, do you have any other questions? Melissa Frick?
No, I think I'm good. I'm wondering, is there any additional demographic information you might be able to share about some of the people in these outbreaks? Was there a large portion of Hispanic or Latino residents that were exposed to the virus in this outbreak?
I think the demographic data that we have available is what we have been sharing. I know we've had some internal discussions on trying to be able to provide that data, but for right now, that is what we are able to access.
Yeah, I understand. All right. Well, thank you. I appreciate it.
You're welcome. Hannah, you had another question?
Yes. I was wondering what the timeline is between getting tested and receiving the results and then being posted on the website, or does it vary based on the location people are getting tested?
Robin, you want to handle that one? Or Dr. Morse?
So I think, Robin, you can go ahead if you want. You probably know the turnaround for the facilities in your location best.
It's pretty variable. We see some people actually getting a rapid test in the emergency room, and we'll know those sometimes within 24 hours. Other testing can take 48 hours. There are some labs that can take longer, even 7 to 9 or more days, unfortunately. So when those numbers pop up, it can be very, very confusing for people and so variable that you're going to see some fluctuations in the data just based on the laboratory issues. So once they're positive, we get a report into the Michigan Disease Surveillance System so that the state can count those numbers by county. We spend a lot of time and effort making sure addresses are correct and that cases get counted appropriately. So those are the numbers that you see reflected on michigan.gov/coronavirus. And so it's pretty quickly reported once we are notified of the case.
Sorry, I was muted. It's 4:05. How about just get the last questions in here, a couple more questions, and then we'll call it a day. Hannah, did you have any more questions?
I think I'm good.
Okay. We did have another person join the call. Taylor, I don't know where you're from, but do you have any questions you'd like to ask?
Hi, sorry. Yeah, I got the time wrong. This is Taylor Wisner from Interlochen Public Radio. I think I'll just follow up with you, Janine, to hear what I missed.
Okay. Well, we recorded this, so we'll make sure that you have access to it and you can listen to everything that we covered.
Okay, thanks.
Okay, if there's no more questions, we're going to call it a day. And again, we encourage you to push out the invite that we sent to you to invite the general public in Oceana County to come to the virtual town hall, and we'll be covering this information with them as well. So thank you all for your time, and we appreciate it. And please feel free to reach out to me if you have any additional questions. Thank you all very much.
Thank you.